We've all probably experienced that heart-dropping moment. You go to the bathroom, do your business, and when you look down into the toilet bowl, you see red. Seeing blood in the toilet or on the toilet paper is enough to make anyone panic. Your mind immediately races to the absolute worst-case scenario. But before you let fear take over, take a deep breath. While seeing blood during a bowel movement is a symptom you should absolutely never ignore, it doesn't automatically mean you are dealing with a life-threatening situation. Our bodies communicate with us in very specific ways, and the digestive system is no different. Believe it or not, your stool is one of the primary languages your gut uses to tell you exactly what is going on inside your body. Today, we are going to break down exactly what your body is trying to say. We will decode what the different colors of blood actually mean, look at the most common causes ranging from easily treatable to more serious, and clearly define exactly when you need to stop what you are doing and head straight to the emergency room. By the end of this, you will know exactly what steps to take to protect your health without the unnecessary panic. To truly understand why this happens, we first have to recognize how deeply connected the digestive tract is to our overall well-being. The gut is often referred to as the body's second brain, and for good reason. It dictates so much more than just processing the food you eat. A healthy, well-functioning digestive system translates to a much better quality of life. Because of this, the waste it produces is essentially a daily health report card, giving you real-time feedback on what is happening inside your body. The problem is that most of us are guilty of what you might call the blind flush. You finish your business, stand up, hit the handle, and walk away without ever glancing down. We are conditioned to view it as something entirely unpleasant that should just be disposed of as quickly as possible. But forming the simple habit of actually looking at your stool, checking the water in the toilet bowl, and inspecting the toilet paper before you flush is actually one of the most proactive and powerful things you can do for your own health. So, what exactly should you be observing? You want to look at the overall consistency. Is it normal, or are there visible, undigested food particles? Is the water in the bowl tinted? And naturally, are there any visible drops or streaks of blood? But it is not just about spotting blood. You also need to pay close attention to the physical shape of the stool. For instance, if you notice that your stool has suddenly become very thin, perhaps flattened out, or looking almost like a narrow ribbon, that is a significant warning sign. It can indicate that there is an obstacle or inflammation physically narrowing the passage inside your colon. Your daily habits in the bathroom provide vital clues, and paying attention to them is your first line of defense. Now that we have established the importance of looking, let's talk about what you are actually seeing when you look down. When it comes to blood in the bathroom, the color of the blood and exactly how it is positioned are two of the most critical pieces of information you can gather. They act like a diagnostic map, pointing directly to where the bleeding is likely coming from in your digestive tract. Let's start with what is arguably the most common scenario. You finish your bowel movement, you wipe, and you see bright red blood on the toilet paper. Or perhaps you look into the bowl and see a few drops of bright red blood splashing into the water or just coating the very outside of your stool. This type of blood is fresh, vibrant, and looks exactly like the blood from a fresh paper cut. When the blood looks like this and is clearly not mixed into the actual stool itself, it almost always means the source of the bleeding is very close to the exit point, specifically in the anal canal or the lower rectum. Because the blood hasn't had to travel far through your digestive system, it hasn't been broken down or altered in color. Now let's look at a completely different scenario. What if you look down and the blood is not just sitting on the surface, and it isn't just on the toilet paper? What if the stool itself is visibly impregnated or mixed with blood? You might see dark red streaks woven right into the center of the stool. This is a significantly different situation. When blood is physically mixed into the stool, it tells us that the bleeding is happening higher up and much deeper inside the colon. The stool has had time to form and mix with the blood as it traveled through the intestines. This is a very specific warning sign that absolutely requires a thorough medical investigation to find out what is happening deeper inside your body. But there is a third scenario, and it is one that many people don't even realize involves blood. What if the blood isn't red at all? Sometimes people go to the bathroom and notice their stool has turned completely black, resembling the color and sticky consistency of dark road tar or asphalt. Along with this very distinct dark appearance, it carries an incredibly strong, harsh, foul odor that is much more intense than a standard bowel movement. In the medical field, this is called melena. Melena is a sign of significant bleeding, but it is not coming from your colon. This black, tarry stool means you are bleeding from the upper part of your gastrointestinal tract, usually the stomach or the very beginning of the small intestine. By the time that blood travels all the way down many meters of your small and large intestines, it has been completely digested by your body's enzymes, which is exactly why it turns black and smells so terrible. This could be caused by a bleeding stomach ulcer. It can also be caused by bleeding varices in the esophagus, which are swollen, fragile veins often seen in people dealing with severe liver disease or cirrhosis. If you ever see black, tarry, foul-smelling stool, you need to seek urgent medical care. Because the issue is high up in the digestive tract, doctors will need to perform an endoscopy, going down through the throat, to find the exact source of the bleed and treat it immediately. So what is actually causing this bleeding? While the goal here is absolutely not for you to try and diagnose yourself at home, understanding the common causes, ranging from the relatively harmless to the more serious, can help alleviate that initial panic and give you a clearer picture of what might be happening inside your body. Let's start with the usual suspects, which are very often responsible for that bright red, fresh blood we just discussed. In many cases, the culprit is something very simple and highly treatable, like hemorrhoids. Hemorrhoids are simply swollen, irritated blood vessels located in the lower rectum or just outside the anal area. They can easily bleed when aggravated. Another very common cause is an anal fissure. This is a small tear or cut in the delicate tissue lining the anal canal, frequently caused by straining too hard in the bathroom or passing a particularly large, hard, or dry stool. While a fissure can be incredibly painful and produce a frightening amount of bright red blood on the toilet paper or in the bowl, it is generally a localized minor issue that can be easily resolved. And speaking of resolving these bathroom struggles, if you frequently find yourself straining, constantly feeling bloated and sluggish, or you just can't go to the bathroom regularly, there is a fascinating way to restart your digestion. It involves a strange 8,000-year-old underwater gut superfood. By adding just a one-pinch trick to your routine, your body can fully eliminate up to 10 pounds of toxic poop that is currently clogging your intestines, allowing you to empty your bowels twice as fast. You can achieve a light, healthy, and comfortable digestive system in just days, without any restrictive diets, expensive probiotics, or medications. To see exactly how this works, point your phone's camera at the QR code on the screen right now to watch a short, eye-opening video. If you're watching on your phone, you can also just click the link I've placed at the very top of the pinned comments below. Now, returning to what else might be causing your symptoms, as we look at other conditions, the potential causes shift. For instance, in younger demographics, bleeding is very often linked to internal inflammation. If a younger person is going to the bathroom and noticing blood that is accompanied by thick mucus in the stool, frequent bouts of diarrhea, and an overall feeling of abdominal discomfort, cramps, or a general lack of energy, it frequently points toward an inflammatory bowel disease, commonly known as IBD. Conditions like Crohn's disease or ulcerative colitis fall into this category. These conditions cause chronic, ongoing inflammation and sores, or ulcers, along the lining of the digestive tract. As these ulcers become irritated, they bleed, and that blood mixes directly with the stool. Another potential cause is diverticular disease. Diverticula are small, bulging pouches that can form under pressure in the weaker spots of your colon wall, typically in the lower part of the large intestine. Most of the time, these little pouches just sit there and don't cause any noticeable problems at all. But occasionally, a small blood vessel located right next to the wall of one of these pouches can become weak and burst. This can result in a sudden, painless, and sometimes surprising amount of bleeding into the colon. Finally, we have to address the big fear, the underlying thought that makes people so terrified to look into the toilet in the first place. Yes, bleeding during a bowel movement can be a warning sign of a tumor or colon cancer. Polyps are small, fleshy growths that can develop on the inner lining of your colon. While they are usually harmless at first, polyps can easily bleed as stool brushes past them. And over time, if left unchecked, some types of polyps can mutate and develop into cancer. As a cancerous tumor grows, it continues to bleed. Furthermore, because a tumor physically takes up space inside the colon, it can force the passing stool to squeeze past it, which is exactly what causes that highly suspicious, narrow, flattened, or ribbon-like stool shape we mentioned earlier. This is exactly why you can never just brush off rectal bleeding by simply assuming it is just a hemorrhoid. While it very well might be something minor, the symptoms of a harmless condition and a very dangerous condition can easily overlap. While most instances of bleeding during a bowel movement require a prompt visit to a doctor for evaluation, there is a very clear difference between a symptom that needs to be checked soon and a situation that demands immediate critical action. It is vital that you know how to recognize the red flag symptoms that indicate you are experiencing a severe hemorrhage. We are no longer talking about a few small drops of blood spotting the toilet water or a single streak on the toilet paper. If you experience a sudden massive loss of blood, a large volume of blood filling the toilet bowl, you are dealing with a medical emergency. When your body loses a significant amount of blood very quickly, your system goes into shock. You need to pay close attention to what your entire body is doing, not just your gut. If you begin to bleed heavily and suddenly feel a wave of intense weakness wash over you, or if you become incredibly dizzy and feel like you might pass out if you try to stand up, you are in danger. Look out for sudden, severe physical changes. If your skin becomes extremely pale, or if you break out in cold sweats and your skin feels uncomfortably clammy or sticky to the touch. These are all definitive signs that your blood pressure is dropping dangerously low due to the rapid loss of blood volume. This can happen, for example, with a severe diverticular bleed. If you or someone you love experiences these symptoms alongside heavy bleeding, do not hesitate. Do not wait to see if the bleeding stops on its own, and do not wait around to see if it happens a second time. This is a critical situation, and you must go to the emergency room immediately. A massive hemorrhage inside the digestive tract can lead to severe shock or even become fatal if not stabilized and treated by emergency medical professionals right away. Let's finally address the elephant in the room. When it comes to our bowels, there is a massive psychological barrier. It is a topic shrouded in embarrassment and taboo. People simply do not want to talk about their bathroom habits, not even with their closest family members, and certainly not with a medical professional. Because of this stigma, many people choose to suffer in silence. They see the blood, they feel the fear, and they choose to simply look away and ignore it, desperately hoping it will just magically disappear on its own. But ignoring the symptom out of fear is the absolute most dangerous thing you can do. When you avoid the doctor, you allow simple, highly treatable problems to silently grow into complex, life-threatening crises. A tiny, bleeding polyp that could have been quickly and easily removed during a routine exam can mutate over time. Years later, that ignored symptom might result in a massive, life-altering surgery, potentially leaving you requiring a colostomy bag for the rest of your life. This is exactly why we need to demystify the colonoscopy. For many, just hearing the word causes anxiety. But a colonoscopy is a simple, painless, and profoundly life-saving tool. It is the gold standard because it provides absolute certainty. It allows medical professionals to look safely inside, find the exact source of the problem, and very often fix it right then and there before it becomes dangerous. Please do not let fear or embarrassment dictate your health. Early detection is an incredible blessing. Catching a problem early is exactly what saves lives. If you are experiencing bleeding, speak up. Make the appointment, undergo the necessary exams, and get the answers you need to protect your health and your future. Your body is incredibly smart. It gives you warning signs when something is off, and it is your responsibility to listen to them. Seeing blood in the toilet is not a reason to panic, but it is a clear, undeniable signal, a call to action. Take that action. Take control of your health today. Do not let a solvable problem steal your peace of mind or your future. Have the courage to make the appointment, get checked, and give yourself the gift of certainty. Thank you for taking the time to educate yourself today. Take care of your body, listen to what it tells you, and prioritize your health.